there is a black box warning in the package inserts of the GLP-1 receptor agonists. So Trulicity, Ozempic, Bydureon, that whole family, saying that for patients who have medullary thyroid carcinoma or a family history of medullary thyroid carcinoma, they should not take these medications. And that is because in animal studies, there was an increased incidence of related thyroid tumors, C-cell tumors. An observational study looking at almost 41,000 people with type 2 diabetes started on a GLP-1 receptor agonist, almost 75,000 people on a DPP-4 inhibitor, so that's Januvia, Onglyza, and Tradjenta, a little over 50,000 people on SGLT2 inhibitors, that's Jardiance and Farxiga and Invokana, and almost 190,000 people on a sulfonylurea, that's glipizide and glimepiride. And they looked to see what the incidence was of thyroid cancer among these various groups. What they found was that in the first 6 to 12 months, there was a higher incidence of thyroid cancer in the people who are on a GLP-1 receptor agonist compared to the other groups. But if you look at the data beyond 1 year, then the risk is the same. So why is that? The other thing that the researchers found was that in that first year of starting a GLP-1 receptor agonist, or starting medication, the people on GLP-1 receptor agonist were more likely to have an ultrasound of their thyroid done. And so, first of all, you don't develop thyroid cancer in 6 to 12 months, right? Cancer, especially thyroid cancer, grows very slowly. So for someone to start a medication and then get thyroid cancer, that would take a long time. So they suspect, because of the black box warning, that more people were having thyroid ultrasounds done than they would if they were on another medication. And therefore, all these little nodules, that were there that people were unaware of were found. But if you go beyond that 1 year, then the incidence is no greater compared to, people being on other medications. So that means that the risk of developing thyroid cancer is probably no worse if you're on a GLP-1 receptor agonist compared to these other medications. So let me share with you exactly what the risk was of developing thyroid cancer in these groups. In the patients receiving GLP-1 receptor agonists, the risk of developing thyroid cancer, of being diagnosed with thyroid cancer, was 0.17%. It was also 0.17% in the SGLT2 inhibitor group. It was 0.2% in the sulfonylurea group, and 0.23% in the DPP-4 inhibitor group. Now, this was just an observational study, and it did not include people who were on GLP-1 receptor agonists for things other than type 2 diabetes. So this did not look at people who were on it for the treatment of obesity. And people with a history of medullary thyroid carcinoma or a family history of medullary thyroid carcinoma still should not take these medications.